Welcome. Thanks as always to Jay and Vicki for helping us interpret today. So the spread of COVID-19 in Hamilton County is as bad as it has ever been. Yesterday, as you know, the governor moved Hamilton County to purple on the state's warning map. To date, 59,783 people have tested positive for COVID-19 in Hamilton County. That's 1 in 14 people in Hamilton County. We've lost 436 residents of Hamilton County. As we have said before, we wish we were getting more vaccine more quickly, but we cannot control how much vaccine comes into Hamilton County. We can make sure that we are ready to administer vaccines, and we can make it as easy as possible for members of the public to sign up for the vaccine as soon as they're eligible. So several weeks ago, when it became clear that the state planned to distribute the vaccine through multiple partners, including public and private entities, Mayor John Cranley called me to say we needed to coordinate and collaborate our regional vaccination effort. He convened the major hospital systems, the city, the county, at weekly meetings, and it was his idea to have a single central website where citizens can go to sign up for the vaccine. I want to thank the mayor for his foresight. What followed was an all-hands-on-deck effort between the health systems and public health districts. The Health Collaborative, which has been the county's partner in our COVID-19 testing program, stepped up to build a website that would serve as a one-stop shop to share eligibility information, to provide information on registration for those eligible, and to allow those not yet eligible to sign up for updates to know when their tier opens up. Fundamentally, it comes down to this. The vaccine is scarce right now. That said, we need to make it as easy as possible for residents to sign up and get in line so they can get the vaccine when they become eligible. So we've got a couple things to announce today, and I don't want to steal the thunder. We're going to announce a website, and we're going to announce a phone number for people to contact to get in line to get the vaccine. And I'm not going to go into the details of what the governor has laid out by way of the criteria, who is eligible when. I think people pretty much know that. What we know, though, and what's new is that we're going to move from a strictly 1A category that we've been working under to get those folks vaccinated into an additional category come Monday, which is 80 years old and older in Hamilton County, and then we progress from there. I do want to say one thing about the website and the phone number. So the website is the best way to sign up. It's a very efficient way to sign up. We set up a phone number for those individuals that don't have access to the internet. We're hoping that folks that do have access to the internet will use the internet, use the website. We're hoping that the phone number will primarily be utilized for those that can't do it online. I just want to furnish that caveat because we're concerned, I guess, a little bit that we're going to be overwhelmed when it comes to the phone number. So please, if you can sign up online, let's do that. And also, please, be patient. We're just launching this thing. We're trying to keep up with what's going on coming out of the state level. But again, I do want to say that we're doing our best. Mayor Cranley had this great idea. Here we are talking about his great idea. And so with that, I'm going to turn it over to the mayor.
Thank you, Commissioner Driehaus. It's been an incredible partnership between the city and the county throughout this crisis. Thank you for your kind words, but Greg Kesterman and the health department of the county and your leadership has really brought us all together, and thank you. We are going to talk today, and like the Commissioner Driehaus, I'm not going to get into the details of the website and how to sign up. I'm excited it's happening, and Kate Schroeder and the Health Collaborative and others will get more into those details. I really just want to reiterate some of the things Commissioner Driehaus said and just be as transparent and as honest as possible with the state of the vaccine across the country, but obviously most particularly here. First, we are literally now in the worst moment of the vaccine in terms of people having COVID here in Hamilton County and Cincinnati and in our region. We're purple. That's obviously very bad news. That means there's lots of people out there that have it that could give it to you even if they don't have symptoms. So I know it's been tough, long year, but 8 weeks from now, I feel relatively confident that most of us will be in a place to have an opportunity to do a vaccine soon, if not already. The more people get it, the safer it is for everyone. So we're asking for 8 weeks more of masks, limit social interaction, keep distant. Second, we don't control the number of the vaccine. It was a disastrous decision for the Trump administration not to invoke the Defense Production Act and ramp up more than we have. I'm appreciative that they got it approved so quickly, and they deserve credit for that. But we need a lot more vaccine than we currently have. And I believe that President Biden will invoke the Defense Production Act and ramp up production, and I hope he does. And if he doesn't, that would be a big mistake because we need more vaccine. So if you're listening to this and you're not over the age of 80 or in a special category of 1A or a teacher that's going to open on March 1st, you're going to be in line for many weeks. I haven't taken the vaccine. I'm going to wait my turn. We all got to wait our turn. But we don't want to give you the false impression that you can get vaccinated next week because we don't have enough vaccine. However, we want to start building that line and that website and that registration opportunities so that we'll be prepared when the vaccine does arrive in bigger doses. The second thing, and Commissioner Driehaus mentioned this, and I really want to emphasize this because I'm very proud of our region and what we're doing and what we're announcing today, that we are collaborating and working together. The fact is that this should have been a requirement of the federal government and of the state 6 months ago. It wasn't. It isn't. It isn't today. It's only happening here because we have such a wonderful hospital community, health collaborative, city and health departments that work well together, and we're trying to work together. But I want to be clear. If for whatever reason, and I don't want to pick on anybody, as I won't use anyone's name, if your normal hospital system is X, it could be Good Sam, it could be Christ, it could be Mercy. I'm not picking on any one of them. Our website's going to help you get to them, but it is still incumbent upon them to work with you to get you signed up for a specific vaccine time. Meaning we don't have the authority to force anyone to devote X number of nurses or vaccines or time period to it. Our community, our health departments are ramping up the number of people who are going to distribute the vaccines, and I'm also confident that our hospitals are doing the same. But I want to be clear that I still believe, as a matter of principle, that the state should be mandating a universal sign-up system and demanding that everyone devote a shared and publicly known amount of resources to distribute the vaccine. We will publish and share what information we get, but we don't get a lot of information as to who's doing what. We know what we're doing, and we are publishing the number of vaccines that we distribute. And I continue to believe that there needs to be much more transparency than there currently is as to how many vaccines go to any particular provider and how quickly those providers are able to get those vaccines into arms. But having said all that, just to level set the expectations, our region, our health department under Melba Moore, our county under Greg Kesterman, our political leadership, and our hospitals are working together to provide as much sanity to the situation as possible. And we'll now start to get more into those details. And it's my job to introduce the health director of Hamilton County, Greg Kesterman. Thank you.
Thank you, Mayor. I want to start by saying I really am fortunate to serve as health commissioner in Hamilton County at a time where all of us want to collaborate. Everyone is putting aside their own personal interests to make sure that we are able to quickly and effectively vaccinate our community. And it's exciting. It's an exciting time. The mayor just shared that we are in purple, And while the excitement continues to build, I think we must as a community not forget that there is a lot of active cases of COVID-19 within Hamilton County. In fact, there are over 11,000 people that are currently sick with COVID in the county right now as we speak. So now is the time to remember those important things of social distancing, wearing your mask, and keeping sick at home, and hand hygiene. So I really just want to reemphasize that as we start this new phase of vaccine distribution. We know that right now our seniors are going to be the first up to get vaccinated, and this is an exciting time. Commissioner Moore, myself, and many others are making sure that they have access to the vaccine as we move forward. If you don't get a call or don't get an appointment this week, I ask for your patience, and remember, we will not forget you as we move beyond into the coming weeks. We will make sure that there is an opportunity for you to get vaccinated. We will not pass you up. As they continue moving forward, we will begin to list more locations. The state of Ohio has indicated that there will be even more providers in Hamilton County, and I'm excited for this website to be one source where everyone can go to get the information necessary to find locations for vaccine. We as a community continue to make sure that health equity is a priority, and we are reaching people in the communities where they live and making sure that every individual in Hamilton County, regardless of where you live, has equal access to the vaccine. With that, I will turn it over to Commissioner Moore.
Good afternoon, everyone. Mayor Cranley, County Commissioner Driehaus, and Commissioner Kesterman, thank you so very much for this opportunity. I have to say 2 words: sense of urgency, equity. We're taking registrations online now and reaching out to get people scheduled. As of 5 p.m. yesterday, 13,979 people signed up. Some are duplicate entries, but 980 individuals are over 80 years old. Tuesday, January the 19th, we will be launching our vaccine info and scheduling hotline. That number, 513-357-7462. We have a limited number supply of vaccines, as you have heard. Only 200 promised for next week, and our plan is as follows. Some vaccines to the Cincinnati Health Department primary care patients. Some vaccines will go to the low-income senior apartments where large groups of seniors are living in close quarters. 100 eligible members of the public who register with the Cincinnati Health Department under Tier 1B are also being selected at random and scheduled by our Cincinnati Health Department. Again, I have to reiterate, we have a very limited supply of vaccine, and it will take time to move through these populations. So I ask you, please be patient with us, but be assured we will get to everyone when we can. We are also finishing up our last rounds of Tier 1A. And my plea to you is, if you are qualified under that tier, we urge you to get registered as soon as possible. I'm excited to introduce Kate Schroeder with the Health Collaborative to talk about this great website that we have that you can access and view. Thank you so much.
Thank you, Commissioner Moore. I'm Kate Schroeder with the Health Collaborative. We are very grateful to be here today with all of our partners in government and the public health departments and the health systems and Kroger to be launching a new website. It is www.testandprotectcincy.com. That's www.testandprotectcincy.com, Cincy with a Y. And when you put that into your computer, it will come to a website that has a button for testing, a button for vaccines, and for regional trends. And when you click on that vaccine button, it is a one-stop shop resource for those in the regions to get more information about who is eligible and how they can sign up to register and schedule an appointment. So we can actually go through the website now. I think we're pulling it up. The first thing you will see, there are 3 things we want to accomplish with this website. First, be very clear about who is eligible. Second, for those who are eligible, a list of providers in terms of where you can schedule and register to get an appointment. And third, if you are not yet eligible, you can sign up for updates. So let's go through each of these sections. We'll start with the first one, which is a list of who's eligible. As you heard from the commissioners earlier, right now who's eligible is 1A, and starting on Monday next week, it's those who are 80 years old and older. So if you fall in one of those categories, you are eligible, and you can click on any of the logos on the site, and it will take you to how to sign up with those organizations. There are hotlines on there as well. And Kroger, after me, I'm not going to steal the thunder of Erin from Kroger's, but we are excited that they will start offering public appointments beginning next week as well to those who are eligible. There is also a hotline, 211. We're grateful to our partners at United Way for standing up 211 so that anybody who doesn't have a computer or struggles with access online can call 211 to get help. But for those that do have computers, or you can do it on your phone, it's best to use the website. Again, that is www.testandprotectcincy.com. And last section of it, so first it's who's eligible, second it's if you're eligible, how do you schedule and sign up, and third, if you're not yet eligible, you can put your information in here. You click on the button that says not yet eligible, and you put in your information, your phone number, your email, and we will send you alerts and updates when new rounds of eligibility open. So this is going to continue to be updated at this website. As soon as new rounds open, we will update the website. As new providers come online offering the vaccine, we will add them to the website. And I am so grateful to all of our partners who are here today and working with us. Our health providers, our public health departments. This is an all-hands-on-deck effort to get shots in arms so that we can save lives in our community and help to fully and safely reopen our economy. So with that, thank you, and I am going to introduce Erin Rolfes with Kroger, who's going to talk about their access to the vaccine as well.
Thank you very much. And thank you to the city, the county, and the public health team for inviting us to join you here today. Truly exciting news. Again, hoping to see the light at the end of the tunnel of the past year. It's been said several times today, but it bears repeating. We will also have a very limited supply of vaccine, but more is coming in every week. So if you if you aren't able to find an appointment for next week, keep coming back, keep trying, because we will have more options available in the weeks to come. One caveat about the information that I'm going to share, we are launching a website and a phone number where you can sign up for a vaccine, but it won't be available for sign up or to call until tomorrow. So please don't log on today, please don't call today, but tomorrow you'll be able to log on and sign up. So that information for the website is www.kroger.com/Ohio COVID vaccine. And that's Ohio COVID vaccine, one word, no underscores. And the phone number is 866-211-5320. Similar to what you've heard about other websites and phone numbers, the best place to go is the website. If you can do that, that's your best bet. Additionally, I'd encourage you not to call our stores or to go into the stores. That's not going to help you jump the line. Really, the website and the phone number are your best bets for making an appointment to receive a vaccine. We're going to be opening appointments on a rolling basis, so if you don't get an appointment tomorrow, continue to check back throughout the week. It all depends on how we get the vaccines to come into our stores. Thank you again to everyone who's joined us today and invited us to participate. We're excited to be the place that provided safe food for you all throughout the pandemic, and now is going to help you get to the other side.
All right. As you can see, this is a huge collaboration. So once again, thanks to the mayor for the idea and the calls to get us organized, county public health, city public health, the health collaborative, the hospital systems, Kroger, Nick Crosley's in the room. He's with the Emergency Management Agency. We just have scads of partners to try to get this done. So we're doing our best. Again, noting scarcity of supply, but we're going to try to get people vaccinated as quickly as we can. And so with that, Bridget, we're happy to take questions. And happy to kick those around.
Thanks, Commissioner. Stay up there. Jenna Ciceres from Local 12 is first, and she has a question for you.
Okay?
Hey, Commissioner, good afternoon. Thanks for taking our question. So as there's, multiple places to register, should people register with more than one place, or should they just pick one? And also, if someone had already filled out the registration survey online, should they register again using the new website that you guys just talked about?
So, Kate, do you want to take this? So, yeah, I'm going to let Kate Schroeder take this.
So if you've registered with the city and county, there is no need to register again with the city and county. You are in their queue. If you want to go to the website to see if your health provider or Kroger has an appointment, you can and should go ahead and do that. The city and county have a very long queue and a very limited supply. As appointments open, they are randomizing outreach to everyone who is in the queue. But if you want to check on the website to look at other health providers and look at Kroger's to see if you can get an appointment in advance, you should go ahead and do that.
And then, sorry to follow up with that, moving forward, should people be utilizing the Test and Protect Cincy website, or should they, try to sign up from Kroger? Like, would that put them in a higher place?
Kroger is on the Cincy Test and Protect. So you can go onto Cincy Test or testandprotectcincy.com. And from there, check Kroger. If Kroger doesn't have it, you can check other providers that are on there as well. But that can be sort of your central source that, it will take you to Kroger, it will take you to TriHealth, Christ, any of your local providers.
Thank you.
Yeah, let me elaborate just a little bit about who's getting what doses, because that's kind of central, I think, to your question. So we're getting around 8,000 doses in the county total every week, all right? So about 500 are going to county public health, about 500 are going to city public health, about 7,000-ish are going to the hospital system, so they each get their own allotment, so it's 1,000 to 1,500 apiece. We're doing the math. And now Kroger is also getting doses, but each Kroger store is getting 100 per store. How many stores are there? There's 100 per store with little clinics. The stores with little clinics are getting 100 doses per store. So you can see how the distribution is kind of like this. So we've created this common website with all of that on it so that people can decide if they want to sign up through the hospital system. Remember, they're getting their doses, or public health, depending on where they live. You could go there. So it's really up to the individuals as to how they want to sign up for the vaccine. But that is the way the distribution is working now. We have a certain expectation that's how it will continue to work. We also expect we're going to get more doses here in the future, and so we'll have the system set up to be able to accommodate more doses.
Thank you. Next up, we have Ann Saker with the Inquirer. She has questions for both health commissioners.
Perhaps Greg or Kate Schroeder can answer this for me. Thank you so much. When does this website go live?
It's live now.
It's live now. Okay. Okay. And I wonder if Greg, you or Kate or Commissioner Moore, I am having real trouble communicating to readers the reason that this rollout has been, we've never done anything like this before, so I'm not sure we can say it's slow compared to what we don't know. But could things have been done differently? And I wonder if the health professionals could say at what point we needed to do this thing to make it go better. Why are the health departments only getting 500 doses of this drug in this rollout? I think, is there some coordination gap that should have been addressed?
Thanks for the question. I think I continue to want to reiterate the fact that public health has only had vaccines in its hands for 3 weeks. So there's a lot of information out there and a lot of media coverage saying it's slow, but it's only been 3 weeks since we started this campaign. Public health is not the only provider of vaccine. We are just one small piece of the puzzle. As Mayor Cranley and Commissioner Driehaus indicated, public health is doing a fantastic job of getting those doses that we get and turning them around and getting them into our community. The other partners are also doing the same thing. Here in Hamilton County, we have 5 hospital systems, and they are working hard to turn those around. So I think the doses that come to Hamilton County are successfully getting into the arms of individuals. We would welcome more vaccine. We'd welcome it quicker. Information is really important, and I think we'll be able to get the job done quickly. Mayor Cranley has a couple remarks as well.
And I just, in my office, Yasmin or Holly can send you the letter that I sent to the director of ODH a week or two ago. You may have it already, but regardless, I think that letter lays out clearly what should have happened months ago. So I think many of us assume that the state and the federal government or the federal government or both were coming up with an elaborate plan to distribute needles into arms. And the fact is they really hadn't done it at all. All they've really done is come up with limitations on who we can vaccinate without any infrastructure in place on how to actually find those people and get into their arms. And the county and the city have done heroic and successful jobs of getting all of our vaccines out within days that we receive them. So I'm very proud of what we've done on the ground, but I continue to believe, as I laid out in my letter in detail, that there needs to be more organized planning and mandatory participation among all providers, sharing information, sharing how quickly they distribute vaccines, and making sure we don't trip over each other as we find people to vaccinate.
Thank you, Mayor Cranley. Greg, just a quick follow-up here. I understand that the public health departments and the hospitals have been pretty overwhelmed with phone calls in the last 5-6 days. Is that the case in your department?
Certainly, we are seeing a lot of phone calls and web traffic. Commissioner Moore shared how many registrations the city has had. Hamilton County Public Health, on Wednesday I shared we had 30,000 registrations, and this morning we are up to 51,000 registrations. So just a lot of public interest in getting the vaccine and making sure people are in line.
And the website covers everyone in Hamilton County, including the jurisdictions of Norwood and Springdale and Cincinnati. They're all if you live anywhere in the county, you can use this website.
Yes, the Test and Protect website is a great resource. If people register on our website, we're making sure to share that information with our partners as well.
Thank you.
Next up, Marielle Carbone from WCPO has questions for either Health Commissioner or whoever wants to take her question.
Yeah, that was my original question, but something kind of came up that might be better for Kate or about just these registrations. You know, I think the biggest confusion we're getting from people is they're hearing, okay, go register, but some places we see people getting actual appointments. Some it's a waiting list, some it's a survey. I mean, what should people be expecting? Is it different from all these various providers? Because I think that's the confusion. People are thinking I can go get an appointment, and really they're just taking a survey and they have no idea what happens with their information. So what can we tell people so it's clear?
Yes, so there haven't been public appointments yet because we haven't had vaccine for the public yet. So vaccine for the public starts next week for those who are 80 and older. So this is the first time that you will start to see scheduling of appointments. Kroger, if you go to testandprotectcincy.com, click on Kroger, starting tomorrow, you will be able, individuals who are 80 plus will be able to toggle through and schedule on Kroger. There are also hotlines for some of the hospitals and other, they have information with the hospitals. Call the hotline for that provider to see if you can get an appointment there. So I do think we are a clearinghouse on the website, and the health systems and health departments are at different stages in allowing their online scheduling, but each of them has the information about how to schedule it. And so for 80 plus, there will be not enough, we would love to do 100% next week, but every one of those vaccines, I would be willing to predict, there is so much demand for these, and we are trying to put this central place together where anyone can.
So essentially it sounds like, say I'm 80 and I'm going to sign up and there's enough doses open still, I should be able to schedule an appointment. If there's not, I would get on this waiting list, or if I'm not eligible yet, it would go to a waiting list.
Yes, exactly. So if you are an 85-year-old sitting, in your home in Evendale, and you want to go online there, you say you've already registered. Maybe you've already registered with the county, you're in the queue there, but you go on, check Kroger, see if there's any appointments with Kroger. And say you're a patient at Mercy. There's a Mercy hotline on there. Call if you can't get an appointment with Kroger or you prefer Mercy, call Mercy. See if you can schedule one at one of their clinics next week. You will still be in the queue for Hamilton County if you have not already received an invitation. They will be sending out invitations to schedule, but they have such a limited number of doses. So I do think if somebody hasn't registered already and they go through the options online and don't find one, then they should register, absolutely, to get in the queue there, because those notifications will continue to go out.
Okay, and then just the original question I had for either health commissioner. I know that this isn't a problem that really, I guess, can be solved by you guys because you're limited to, you find out the day before the amount of doses you're getting, and then you move forward with that. But, you know, it seems like we see what's happening in Kentucky. It seems like they're moving pretty quickly and smoothly. They're getting their drive-through sites open, and now 70 and plus, and teachers are able to start getting things done. So I guess just how do people kind of wrap their minds around why that's not happening here and why it's moving faster just across the river?
So I think it's important to remember that each state has a different plan, and Ohio's plan right now is limited to phase 1A and 1B. Phase 1A is those living in nursing homes or working in nursing homes, as well as medical professionals that have been putting themselves at risk throughout this pandemic. Now we are moving into phase B, and the governor has indicated he has selected phase B because he knows those that are 65 years and older are most likely to die from getting COVID-19 or have serious illness. So while some states are opening things up more widely, Ohio is trying to target those populations that are greatest hit. I'll pause there and see if Commissioner Moore has anything else she would like to add.
Thanks, Muriel, and Commissioner Kesterman. I would just say, you know, based on our plans, we're moving as quickly as possible. This truly shows, that's why I use the word sense of urgency, acting with that sense of urgency and being nimble to quickly adjust. And it's, you know, in some business cases, it's just in time vaccine when you think about it, and planning that you get notification you're going to receive it, and then you work your plan. So as soon as we receive it, we're getting it into the arms of the people that need it the most under 1A and 1B.
Thank you both.
Can I don't mean to keep interrupting, but let's level set here for a second. So the idea is that, and we've been saying this, we have not enough doses to vaccinate everybody that's eligible. That has been the case and will continue to be the case until we get more doses. Let's level set this for a second. In Hamilton County, there are 28,000 people over the age of 80. So they're eligible starting Monday. We have about 8,000 doses coming to Hamilton County through all these systems. So you can do the math here and start to understand the challenge. Until we get more doses, we will not be able to vaccinate those that are eligible. Not all of them, some of them, and we're going to continue to work through this system. But we share this frustration that we don't have enough doses to do the folks that are eligible. So anyway, it is what it is. We're working through it. We're doing our best to make sure people get in the queue. But the fact of the matter is, not everybody's going to get the dose as quickly as we would like them to.
Thank you. Mike Shell with Fox 19 has a question for the mayor.
Yeah, first of all, can you hear me okay? I'm kind of in my car here.
Yes.
Yeah, first I want to commend everybody involved in this today. The information has been concise and thorough. Very, very good. It's very easy to work with, so I appreciate that. Mr. Mayor, I don't need Erin to come up to the podium. If you can just ask her, is this all Kroger locations in Kentucky, Indiana, or just in Hamilton County that's going to be giving up the shots?
Hi there, happy to answer. It's right now today we're talking about all Kroger locations with Little Clinics in Ohio. As we continue to work with the governors in the other states, we'll roll out more information about that. But great question. Today we're just talking about the stores with Little Clinics in Ohio.
And how many stores have the little clinics? Because not all of them do, right?
That's correct. So more than 20, it was my fault for not counting before I got here, but more than 20.
Can we get a list of those at some point?
I can provide that to you.
Because if you live by a Kroger, you say, hey, I can just go up the street and get a shot. But, if they don't have a little clinic there, it might be, 10 miles away.
Yeah, truly your best bet will be to log on to that website or call. Going into the store or calling the store itself is not going to help you get an appointment.
Will there be a list on the website of the stores that have the little clinics and what neighborhoods they're in?
That's right.
Okay, fantastic. Thank you.
You're welcome.
And Mr. Mayor? Just had, like I said, the information here has been fantastic. Just want to look at this on a historical point between the collaboration between the city and the county. We had this collaboration back in 2001 with the riots. We had it after 9/11. Can you think of another time? Would this be unprecedented, the collaboration between the city and the county with this entire COVID situation?
I think it's a role model for collaboration between the city and the county. I'm very proud of the relationships that Commissioner Driehaus and I have formed, that Greg and Melba have formed, and that we're all in this together. So I think you're right to point that out, and it's a great moment of unity. I hasten to add, as I said earlier, that we could still use significantly more help from the state and the federal government to mandate more transparency of sign up and sharing of all the different providers of vaccinations, so that we can more quickly get somebody in line as the supply increases.
But you're confident you are maxed out and the county is maxed out of what you can do?
Yes, we need a lot more vaccines, which we don't control, but yes. We for as many vaccines as they give us, and we hope they give us a lot more.
Okay, thank you.
Next up, we have Todd Dykes with WLWT, and he has questions for Kate and Aaron.
Hi, Aaron. I'll pose the first question to you. Good to see you this afternoon. Aaron, I'm actually working on a story more broadly about the state's website, and my colleague Meredith Stutz is going to ask a question momentarily, but she had actually gone on and looked and realized that, the availability of appointment making through the little clinics will happen tomorrow. So with that said, Governor DeWine launching the state website, it's online this morning. What word would you have for people that are not watching this, and we'll have to get this message out to them, that they're not in Hamilton County, they're Claremont, they're Warren, and they're going to little clinics or Kroger on the drop-down menu on the state website, but it doesn't say anything about COVID. Help us walk through that for them.
Sure. Across all of Ohio, not just here in Cincinnati and Hamilton County, but even up through Columbus, with this website, the Kroger.com/Ohio COVID vaccine, is the best place to go to schedule that appointment, no matter where you are in Ohio. And again, clarifying, we're just talking about Ohio today. As we continue to work with the other governors, more will roll out soon.
Do you think, was Kroger part of the state rollout? Do they know that, do you think, in Columbus, or do they just put all these Kroger locations out, and now there's going to be a lot of confusion, at least today, I guess, until we can get the word out, right?
Yeah, we've been working with the governor's office as well as the state to make sure that they're aware of everything that we've been doing along the way. They've been great partners with us as we've been standing all this up.
Okay, sounds good. I appreciate it. Thanks, Aaron. Good to see you. And Kate, I'll ask you a real quick question, if you don't mind. With regard to, so for example, I live in Northern Kentucky and I work here in Cincinnati, and of course, it is Hamilton County, but it's not the jurisdiction of. I know that, and Ann asked the question about jurisdictions. What would happen? It seems like a worst case scenario if I tried to schedule an appointment here because I work here, and I don't know if I'm eligible. You can tell me on that in a second. But then I also try to schedule one in Northern Kentucky, and suddenly I'm scheduling all over the place, and I've got appointments, and then I don't show up to the appointment here in Cincinnati, and I go to the one in Northern Kentucky. Does that mean a dose is wasted here? I mean, how are you safeguarding against that from happening?
I mean, everybody that is, all the providers, the vaccine providers are doing, they're not wasting doses. I mean, that is, we have so much more demand than supply. The doses aren't getting wasted, but please do not skip an appointment. These are sacred. This is your opportunity. So we should not have people scheduling appointments at multiple places. I think if you go to Test and Protect Cincy.com, you will find there is a link to Kentucky on there. For those that are, if you're not in Ohio, here's the information for Kentucky, here's in the hotline for Kentucky, and the same for Indiana. It links to the website in Indiana that has a list of all the providers there. St. Elizabeth's is also on there, and you could, at testandprotectcincy.com, you can click on St. Elizabeth, and they have online scheduling, so you could go through and schedule there. So I would try with your home jurisdiction.
But Kate,
is
since
the
I
idea.
work here and since I work in Cincinnati, am I eligible, or have you all thought what does that look like? I know the testing I would be eligible, but what about the vaccine? Because that's a big question for Indiana and Northern Kentucky.
If
both.
you live or work in the jurisdiction, you are eligible.
And last question for you, Kate. Okay, I'm going to let you alone after this one. The governor yesterday, so he was asked by a reporter about the limited weekend vaccination effort. And the governor was frustrated. He said, we need more providers to be available on weekend and have these hours. And maybe this is for health, I don't know, commissioners, but what's your sense of that? Will there be more weekend appointments, or where does that stand?
I do. I mean, everyone is standing up their clinics right now, but I do expect a lot more. I believe Kroger is available on the weekends, and College Hill tomorrow for the city. There are a lot of, I think Mercy has some weekend appointments coming up as well.
Thank you.
Yep.
Meredith Stutz with WLWT has questions for commissioners and Aaron.
Good morning.
Thank you so much, Commissioner. Hey, this is Meredith. I appreciate your time this morning. So we mentioned 2 phone numbers today, that 513 number, but also the 211 number. What's the difference between those numbers?
The 211 number is kind of a one-stop shop where you can get information about some of the vaccine locations in Hamilton County. I believe the other number, I actually am not certain, was it the Kroger? There was a number provided by Kroger as well this morning.
Commissioner Kesterman, this is Commissioner Moore. Meredith, the number that I provided, the 357-7462. If you remember, Ms. Schroeder mentioned, we know that there are people who do not have access to computers, and if it's easier for them to just call that number, there's a live person there to actually take their information, help them through the process.
So would I be correct in saying the 211 number is to understand about the vaccine in totality, and that number that you're mentioning, Commissioner, is essentially a person-to-person appointment number?
Yes.
Okay, thank you so much. Next question. This question might be for, we'll do this one next. So we know right now there's that survey page that's up through Hamilton County. It has an orange bar at the top. Is that page still live and necessary now that we have this new website being launched?
Before we jump into this, I just want to clarify on the 211 number. The 211 is an overarching number that will help you navigate all of the providers in the area. The number that Commissioner Moore shared is the best number for the city of Cincinnati to reach with them. Kroger has its own number. All the numbers are available on the website as well. Or you can be given, if you call 211, they can share the numbers to the individual providers.
Thank you. Can we go back to that survey form? Is that still necessary, viable? Now that you have this new website, do we direct people to that website still, the survey form?
I'm going to hand over to Commissioner Kesterman.
Sorry, lots of partners in the room, and we want to make sure we get the correct information to you. So our website, the registration form at hcph.org, is still a valid form, and it gets you on my list at Hamilton County Public Health for the vaccines available. So you've heard that there are many providers, and we're asking you to make sure that you get registered with the provider that you think would fit you best. So yes, if you want to register with HCPH, please come and register on our website.
And then do you have any recommendations or clarifications now that Hamilton County is in the purple and we are now entering into Martin Luther King Jr. weekend? And do you have any advice or concern with people who might still be wanting to participate in a motorcade or in a limited march or gather with their family or churches or community groups to celebrate this weekend? What is your advice to them now that we are officially in the purple?
Thank you for that. You know, it is really important to remember at this time that there is a lot of COVID-19 in our community. And I think Purple should serve as that reminder that if you were planning on doing get-togethers, now is not the time. This is the same message we've had throughout the pandemic. We know that gathering together creates increased risk for you and your family and friends, and it can ultimately end up in people getting seriously ill or even passing away. So if you have big plans this weekend, I would ask you to reconsider them. That said, there are some plans where, you know, like a motorcade where people are driving in unison to a location. Those types of activities can be done safely, and so it's just really important to visit those activities and make sure the activities you're choosing are safe.
Thank you. And then finally, does this new portal that we have, this Test and Connect, Cincy, I think is the website. Does that give a normal person the ability to say, hey, Mercy has this many vaccines available at this site, but Kroger has this? Is that a real-time website that is ticking? Like you might start with 100, but at the end of the day, it might have 20. Will I see that 20, or will I just see, you can come to this site? How will that be managed in real time?
Yes, so right now it is a central one-stop shop that gives you a menu of options of providers where you can schedule. So if you go on to Kroger starting tomorrow, you will be able to click through and see their appointments. For most of the others, they are in the process of setting up online scheduling right now. So I would expect in the coming days and weeks, you would be able to click through the different providers on there. Most of them have hotlines coming up, but it is, so I think we will get to a point where for all of them, eventually you will be able to see the appointments that are open, but that is very much a work in progress. And we are dealing with a comparatively smaller population next week in that it is 80 plus. That's the main focus right now.
Thank you, Kate. And one more question for you. So now that we have this website and people are encouraged to go see it, but to be honest, it's just, they might see it as, oh, it's one central location, or some people would be like, it's one more step I got to do and I'm not there yet. So there might be a headache. What is your word to people who say, how is this actually going to help me?
This is so important. It protects your family, it protects our community. We have lost so many lives. I think probably everybody watching today probably knows someone who has passed away from this, and our way out of this is vaccines. And it's gonna take all of us, especially those populations that are most at risk. So it is really important for those tuning in to, if you are eligible, go and get your appointment. It is a way to protect our community and to help reopen our economy the faster we get there. And we are so lucky, as we've talked about today, to have this collaboration of partners here is really unprecedented with the government, with public health, with Kroger, with our hospitals. So we want to be the best, we want to be best in class here so that every vaccine that comes in is out the door and it is getting to the right person. So I would just really encourage folks to sign up. If you have, call your grandparents this weekend, check and see if they have signed up, your parents, your grandparents, help them navigate the site, or give them the information to call.
Thank you.
Yep.
We have Chris Wederick with the Business Courier, and he has questions for you, Kate.
Just to make sure, as I'm scrolling through this website, it doesn't look like you could actually sign up to get in the queue, right? That's something you still have to do with the health departments, or trying to get in the queue at the providers themselves, right?
Yes, so the city and the county have queues that they are reaching out to for their allocations. Because the way the state is running it, every entity is getting its own allocation. So if you want to get in the queue for the city and county, yes, you need to sign up to be in those queues if you haven't already.
And the city and county queues only gets you a vaccine from one of the 500 or so that they're receiving, and I understand that it's probably going to increase. It's not like if you're in one of those queues, they're going to send you to a hospital to get it. Is that correct? That might be for the commissioners. I don't know.
Yeah, that is correct. So that is why we are also encouraging, even if you've already registered, check the website, check and see if your health provider, your health system, check and see if Kroger, because the more we get folks, we want to make sure we're optimizing our capacity across the region. And the city and county are going to get every one of those doses out as fast as possible, but we also have an obligation to meet our most vulnerable populations. And the folks that have the ability to get it through their health system or to get it through Kroger should move forward and do that.
And maybe this is just a question for the mayor, given what he's said earlier about the national and state organization of this. But shouldn't I be able to go to one website, enter my name, and somebody is coordinating this, and they go down the list and say, okay, TriHealth has a dose available, go there at this time. I mean, is that really the failure here? Because it seems like you're telling people.
You're saying it exactly right. You are 100% right, 100% right. It is very frustrating that there is not a mandate that we all schedule together. It's incredibly fractured, and there was no planning at all until we started to self-plan ourselves. And so, we don't even know if Hospital X gets 10,000 vaccines, how quickly they go through the vaccines. It's all collated at the county level and the state level and slow in uptake. You're absolutely right. There should be one requirement that every region organize and schedule with all the shared resources available. That's what I'm asking for, and I will say that from where we were 2 weeks ago to where we are now, we're far more collaborative than we were 2 weeks ago or 3 weeks ago. So I think as a region on a voluntary basis, we are getting closer to that ideal, but as you point out, we're a long way from that ideal. And I don't think it should be, candidly, I don't believe it should be, because people think it's a nice thing, a right thing to do. I think they should be required to do it. We should be required to schedule with the county. We're doing that anyway, but the point is that there should be a requirement for every region in the state to have a uniform strategy so that, like you said, you could sign up and then 3 weeks from now, for some reason, Kroger gets a big batch of vaccines. Everyone on the website would automatically start being funneled into that Kroger line. By having this website, I think we begin the process on a voluntary basis locally to move in that direction, but it should have been required months and months and months ago by the federal and state government, and that infrastructure should have been created by the federal and state government. And I think we thought it was being created, but it wasn't, and now we're doing what we can locally to make it happen.
Thank you.
We have William Monier from the Cheviot Gazette with questions for the mayor or Commissioner Driehaus.
Good pronunciation on the last name. Thank you. Mr. Mayor, Commissioner, with the average age of residents living in nursing homes facilities throughout the state of Ohio being under the age of 80, and 54% of all COVID-related deaths in the state happening to residents coming from nursing homes, in your view, is the state's plan to prioritize vaccine distribution based solely on age alone, rather than a combination of age, daily exposure, in turn creating an avoidable risk for seniors whose home is literally the deadliest place in the state?
All right, I think I heard your question. So what's happening is the governor is setting the priority. The priority has been for healthcare workers who are exposed to the virus, congregate settings like nursing homes, especially those that are elderly, first responders, EMTs, have been on that 1A list, right? As we are moving through the list, the governor's priority is clearly people that are most likely to die if they get the vaccine or they get the disease. So I've got a stat here, 86% of the people who have died in Ohio have been over the age of 65. So that's the target population for the vaccine. That is the governor's criteria, and that is those are the guidelines that we are following.
Yes, I was asking if, in your view, could this be tweaked to everyone that's in a nursing home, regardless of just age, in the early rollout?
Congregate settings, yeah, they are in 1A. Yeah, those congregate settings were in 1A.
Okay, not just 80 years old and up.
That's right. Yes.
Thank you. Ann Senker has a follow-up question for Mayor Cranley or Commissioner Driehaus.
I had my first question. It's actually for either Commissioner Kesterman or Commissioner Moore. So a couple of weeks ago, Secretary Azar said the government had a reserve of vaccine supply that they were going to release, which conveyed the impression that there was a reserve that this would automatically help you ramp up the amount of vaccine that would be available. Washington Post is reporting this morning that, in fact, that reserve never existed. Do you know anything about this? What was there indeed a reserve that you know of?
The only item that I've heard recently being discussed is whether or not states and federal government should hold back the second doses to ensure they have the allocation for the second dose. Here at the local level, Commissioner Moore and myself are required to follow the state's leadership and direction on what doses we are able to give. If Hamilton County Public Health receives 500 doses, at this time the state is telling me to administer 500 doses to people. The state is holding back the additional doses at this time and are considering making an alteration based on the new federal guidelines.
Okay. Just to quickly follow up here, I'm sorry, Commissioner Moore, did you want to say anything about that?
No, that just we're following the state guidance on making sure we get that vaccine out 24 to 48 hours as quickly as possible.
All right. And commissioners, Mayor Cranley sounded mighty optimistic a little earlier in this hour when he said maybe 8 more weeks and we can get this underway. You think 8 weeks is where is that fair, or are we looking at 12 weeks, 24 weeks? What do you think?
I think the mayor said correctly, we as a community are going to get every dose that is given to our health departments and our health partners into the arms of people that need the vaccine. And so as allocations come to Hamilton County and Cincinnati and all of our providers, we will get those doses into people so that we can start reducing the virus here. I appreciate Mayor Cranley's efforts to bring more vaccine to Hamilton County.
Yeah, and I just want to add, in my opinion, President Trump should have invoked the Defense Production Act a long time ago to get us more supply, and I believe President Biden should do it. In 1947, New York vaccinated 6 million people in 2 weeks. And so there's no excuse. I'm not saying they will all be here in 8 weeks. I'm saying they should be here in 8 weeks. And I'm calling upon anyone and everyone who can make that happen to make it happen.
I also want to provide one clarifying point. I know it was asked about vaccine administration on the weekends. We have a clinic that we're standing up tomorrow. On Saturday. It will not be at College Hill tomorrow. It will be at our health department headquarters site, and it's for people who have already been scheduled. Subsequent weekends, we will be at the College Hill site, and we'll make sure that's really clear for everyone to receive that, to know where we're going to be each weekend, and we're going to stage up to have Sunday appointments as well.
Thank you. Finally, we have Jenna Ciceros from Local 12 who has another question for Commissioner Driehaus.
Hey there, last question again for you. So forgive me if I missed this, but when exactly will the vaccines be given for both the city and the county? Does that start next Thursday and Friday like you had mentioned earlier this week, or is that updated since?
It'll start next week.
Do we have a date though, like Monday, Tuesday, Wednesday, Thursday?
Hamilton County Public Health is Thursday and Friday. The city, Melba, help me.
Sure. If we receive the vaccine for 1B next Tuesday, we will be ready Wednesday, Thursday.
Pretty much.
Thank you. And then, sorry. And then basically today, people can physically start making their appointments and get a date and time of when they can go to get this vaccine, correct?
I think that's a misinterpretation. So let me say two things as we close out here. The website that's being set up and the phone number are both to help people navigate how to get in the queue to get a vaccine. So you go onto the website, you see the different options as been referred to. Is it Kroger? Is it public health? Is it a hospital system? You choose one, you go in, there are hotline numbers particular to that system and a website there, and you go in and you sign up. You try to get in the queue basically. And so this is a navigation tool because the mayor and I are always getting questions from, how do I sign up? Where do I go? I don't know where to go. It's so confusing. And it is. How do people know that Kroger is doing vaccine? I mean, who knows? So you go to a common website, well, there it is. These are all the providers that have been provided vaccine, and choose one and go get in line. Fill in the application and get in line. So it's the answer to that question. To the question, well, some people don't have internet access. We've got a hotline number, 211. People should call that only if they don't have internet access. And again, it's a navigation tool to get people to the appropriate spot to get into the queue. That's what we're trying to do. I mean, I think it goes without saying, we're trying to build the plane while we're flying it. You know, I mean, this is challenging. There are some uncertainties. We don't know how many doses we're getting week to week. We're not always sure who the providers are going to be. And so it is complicated. What we're trying to do is make it as simple as possible for the residents of the county and the city to say, where do I go to get in the queue? Go to the website. Go to this Test and Protect Cincy.com to get directed in a direction to get in the queue.
Okay, that seems to conclude our questions from reporters.
All right. Thank you all for joining.